Welcome to the second video of the basic elbow series. In the first video, we examined the bones of the elbow. Today, we'll be looking at the ligaments. So starting off on the medial side, just get rid of that. On the medial side, we have the UCL or the ulnar collateral ligaments. And the ligaments on the ulnar side or the medial side are really important in protecting the elbow against any valgus forces, so any forces hitting the forearm or the elbow from the outside. And the UCL, ulnar collateral ligament, has three bundles. We have the anterior bundle, the posterior bundle, and the transverse bundle. So the anterior bundle is the most important restraint against any valgus forces. It originates on the inferior surface of the medial epicondyle and inserts itself on the coronoid process. The transverse bundle does actually the least amount of work against supporting the elbow against any valgus forces, and it originates on the medial epicondyle, and then also it inserts on the coronoid process. The posterior bundle originates on the medial epicondyle and it inserts on the olecranon process or the point of the elbow, and this ligament becomes taut whenever I extend the elbow. So there you have it, the UCL, which has the anterior, transverse, and posterior bundles. On the other side, we have the lateral structures. And these structures on the lateral side or the outside are really important in protecting the elbow against any various forces. So we have the lateral ulnar collateral ligament, or the LUCL, which is not depicted here, but this is the primary lateral stabilizing structure, and it's independent of the other lateral ligaments. And if you injure this ligament, this would cause rotary instability at the elbow. The LUCL originates on the lateral epicondyle and it inserts itself on the tubercle of the ulna. And again, it's not depicted here, unfortunately. The next ligament is the RCL, or the radial collateral ligament. And the RCL originates on the lateral epicondyle and it inserts itself onto the radius. This ligament is responsible for maintaining that close relationship between the humerus and the radial surfaces. Last but not least, we have the annular ligament, and this ligament is kind of like 4/5 almost of a circle that wraps around the radial head, and this allows for internal and external rotation of the elbow. The annular ligament allows the radial head to also rotate on the capitulum of the humerus, and that 1/5 remaining part of the circle is the radial notch. So as a review, on the medial side, we have the UCL, which has the anterior, transverse, and posterior bundles. These ligaments support the elbow against any valgus forces. And then on the lateral side, we have the annular ligament, the RCL, and the lateral UCL, which support the elbow against any various stresses. Just as a side note, this isn't really a ligament, but the connective tissue between the radius and ulna is called the interosseous membrane, and this stabilizes the arm against any axial forces to the wrist and transmitting forces from the radius to the ulna. So there you have it, the ligaments of the elbow. We'll go over the muscles of the elbow in the next video, but until then, make sure you guys like, share, and subscribe to Sports Science Student.